welcome back to the Retirement Report. I'm Hank Parrott, your host. Joining me today, Warren Cranford. Warren is a benefit specialist. He can be a big help to you when it comes to Medicare supplement policies as well as Medicare Advantage plans. The nice thing here is that it doesn't cost anything for someone like Warren to help you with that, okay, to be your advisor here. He can come in and help you kind of cut through and narrow down and filter to what's going to be best for you and answer a lot of questions for you that you may have with regard to your specific situation to help you get the plan that is going to best serve you. And so if you want to get, and by the way, if you'd like to get the comprehensive plan, I put the number out there, but also if you'd like to get a meeting with Warren, just call my office and we can arrange that at 615-376-5325. If you call the office, again, if all you want to do is get in for some Medicare information, just call and say that's what you'd like. You saw Warren on TV and you'd like to get an opportunity to meet with him, we can get that arranged for you. As well, if you do want to come in and get a comprehensive plan, or just you got other questions maybe, you can schedule a phone appointment as well as in person, and we can assist you that way. So again, 615-376-5325. All right, we're going to talk about supplemental policies. So we were just covering about original Medicare versus Medicare Advantage plans, and now we're going to talk about those. So when you have original Medicare, you're typically going to need a supplement policy to cover all the deductibles and co-pays not covered by Medicare. And so first, and then of course the alternative being that of a Medicare Advantage plan. So let's start with what Medigap plans cover. So Warren, on this one, this is going to help, of course, with out-of-pocket costs. But what, you talk about the pros and cons, but what does the Medigap plan cover?
Well, it's like you said, just mentioned, so Medigap plans help cover the deductibles, co-pays, co-insurances, depending on the plan. So there's approximately 10 plans that are available. It depends on your birth date, but there are 10 plans that are available to folks out there, and each plan has a different coverage limits. And so based on that, but for the most part, plans cover in the categories like Part A, hospitalization cost, co-insurances, Part B, co-insurance co-pays. There's actually a blood benefit that's a part of the Medigap supplemental policies, Part A hospice care, skilled nursing facility care, co-insurance, Part A deductible, Part B deductible. Sometimes there's Part B excessive charges that doctors' offices can charge up to 15%, depending on the service and that in that facility or office. Also, there's foreign travel, that's emergency travel. Foreign travel emergency benefits and stuff. So depending on the plan that a beneficiary would choose, there's a percentage or coverage that each one of those plans would cover.
So the two caveats like put up on the screen there is, one, it helps cover those out-of-pocket costs, and it's on those things that are approved by Medicare.
Correct.
In other words, they're not they're not kind of bringing extra to the table with the supplement. Right. And let's talk, speaking of which, and let's go into the 10 different Medicare supplement plans. So we've got 10 Medigap plans out there, but that's not for everybody. Correct. That's just coming on now, right? Right,
exactly. So as you see on the chart there, of course, you see the different limits, excuse me, with you have Plan A, B, C, and F are no longer available except for folks that may qualify based on their birth date. Plan D, G, there's actually high deductible Plan G as well as a Plan G. And then there's K, L, M, and N. Now that Plan F is not eligible for folks that didn't turn 65 prior to January 1st, 2020. Plan G would be the next plan that would cover most all of what Plan F did. And also, and to add what you just said too, Hank, regarding supplemental plans and original Medicare, reminder here is dental, hearing, vision benefits are not a part of original Medicare benefits. So,
but now talk about so with Medicare, when you first enroll, okay, there's no underwriting, right?
Correct. During your initial enrollment period, when you first turn 65, if you choose to sign up for original Medicare at that point in time, there are no underwriting questions or health questions at that time. If a person chooses to delay the Part B benefits and enrolls in Part A at the time that they would retire, at whatever time that is, that would be also a special or initial enrollment period where they would not be subject to health underwriting questions.
So it's when you first are eligible at age 65, or if you're continuing to work past the age of 65 and you have health insurance through your employer, then you can still delay, and yet still 3, 4, 5 years, whatever down the road, when that health insurance does go away and you then immediately, of course, sign up for Medicare Part B, you're not going to be penalized for that. And on the Medicare supplements, they still have to basically guarantee issue. They can't turn you down.
Correct. And there are some other scenarios where that might not be the case, but those are also special enrollment periods. So, correct.
And this goes to so talk about that a little bit more, the special enrollment period, how that works.
Yeah, so special enrollment periods would come into play if people were to move out of the service area, if a plan were no longer available. Those are some of the situations and scenarios that would allow a person a special enrollment period. Typically, it's what we see the most of in this industry is when people move from one location to another. They do have the option of a special enrollment period. So at that time, they wouldn't be subject to underwriting questions. Also would be a time where they could explore all of their options as far as Medicare Part Advantage plans, Part C, as well as Medigap plans.
Well, and that's the other. So with the Medicare Advantage plans, you've got, or Medicare, in this situation, Medicare Supplement or Medigap plans are called, when you've got that guaranteed issue. However, without that, you could either be denied coverage by a particular carrier, or you would, or maybe even charged a higher premium.
Correct, exactly. And this is the time of year, Hank, coming up on October the 15th through December 7th is when people can explore their options. If they have a Medigap plan, supplemental plan that they've had for several years and those premiums have increased, that they can explore the options of reducing that premium cost, but they would be subject to, if they change plans, change carriers especially, they would be subject to those health underwriting questions. Right. And sometimes the range is 75 to 85% of folks can pass the underwriting questions and kind of can reduce their premium costs, but it would be subject to those health underwriting questions. Well,
not just, so, you know, this is where cautionary tale, basically when you're going, if you're interested in exploring to see if you have the best plan currently, if you're already on Medicare, and you know, again, you can call my office, we can help introduce you more to Warren, get you more information about that. But Warren, this is one of those areas people are going to basically, if they do apply, of course, just like with any insurance, you do not drop your old plan until you're approved on the new plan. So that's first and foremost. But also, you're able to help them see if there is a better plan maybe for them out there. Yeah. It might be, sometimes people maybe didn't sign up for a plan that might be better for them or give more coverage. This would be an opportunity, even if it doesn't reduce their costs, they might pick up some additional coverages. Right. One of the ones I think is one of the more confusing, easy for me to say, of the Medicare Part is Part D. And this is your prescription coverage. And this is mainly to do with kind of what's covered, what's not covered, and the deductibles, the copay, this whole thing about a donut hole. Maybe you could explain more about Part D.
Yeah, so Part D is the prescription drug part of Medicare. And so with folks, if they are staying with original Medicare as their benefits and they add a supplemental or a Medigap policy, those policies don't include drug coverage, so they would add a Part D standalone drug plan. If they do that and they go that path, then there is a drug deductible that's $480 this year. Now that is increasing next year to $505. So that would come into play if they have a standalone drug plan, and you would just need to talk to your advisor, or those folks that may be handling your drug plan at this point in time, to explore your options there, because those drug deductibles do come into play differently depending on the plan. But your Part D is, like you said, with a lot of Medicare Advantage plans. The Part D is included. There are some Advantage plans that are just don't have that benefit, but there are a lot that do.
Something you can choose from.
Yes, exactly
the biggest
right.
thing, so watch then, you know, as we say in the little chart here, lists of approved drugs vary by plan. So you want to make sure, again, that your, you know, whatever prescriptions you're taking are covered there, that they may change. The coverages can change, so you need to review this every year. And of course, subject to IRMA, meaning your higher income means higher premiums, just as with Part B. Now, one of the things we're going to take a break here. When we come back, I want to delve more into not only the Medicare Part D a little bit, but also we'll talk more about Part A and B again, what's not covered, how these supplements cover that, and what they don't cover, and how that differs with Medicare Advantage. So lots to cover with you. Join us here. We'll be right back on the Retirement Report.